People treat BCAA powder like a shortcut to muscle, as if 3 amino acids can stand in for a full protein plan. Branched-chain amino acids are leucine, isoleucine, and valine. They sit inside complete proteins, but a product that isolates only those 3 is still an incomplete building set. The real decision is whether you need a leucine signal or the broader essential amino acid package that tissue repair actually uses. That framing keeps the purchase honest.
Okay, but the ads make it sound automatic. If BCAAs are the amino acids people associate with training, why wouldn't sipping them around workouts build more muscle than skipping the scoop? Is the claim missing a step, or are we just being picky about labels?
Muscle is the first major stop for BCAA handling. After you eat protein or take a supplement, leucine, isoleucine, and valine are taken up strongly in skeletal muscle, where they can be oxidized or contribute to local amino acid pools. That muscle center metabolism is why BCAAs feel training relevant. It is also why a blood amino acid bump can look impressive while whole body protein balance still depends on the rest of the diet. Context beats the neon label every time. Leucine is the standout signaler among the 3. It can help activate anabolic pathways linked to muscle protein synthesis, which is why so many formulas brag about leucine grams. Think of leucine as a starter pistol, not the entire construction crew. You still need enough total essential amino acids and enough total protein across the day, or the starter pistol fires over an empty job site. Without that fuller amino acid supply, the anabolic alarm rings briefly and then fades.
So if leucine is the trigger, can a high leucine BCAA scoop still help someone who already eats decent protein? Or does that only matter when the diet is thin? And how do we tell a useful leucine push from expensive urine?
A short proof-of-concept trial tested about 6 grams a day of isolated leucine for 4 weeks. In older adults without cancer, appendicular muscle index rose modestly versus a non-essential amino acid comparator. In head and neck cancer patients, that same isolated leucine approach did not improve muscle mass or function. Protein intake stayed below recommended levels, and nitrogen balance stayed negative, which is a huge context clue. Those details matter more than the brand story printed on the tub. This is why complete protein usually wins the practical comparison. Food proteins and quality protein powders bring leucine plus the other essential amino acids your body cannot make. Essential amino acid blends are closer to that construction kit than BCAAs alone. If your scoop only contains 3 amino acids, you may stimulate sensing pathways while still leaving the raw materials incomplete. That comparison should guide the cart before brand loyalty does.
Endurance people still buy BCAAs for fatigue and recovery. If labs show higher valine or a post-exercise synthesis bump, why doesn't that reliably show up as better race times or less soreness people can feel? Are we overreading the blood work when the finish line clock and next day legs stay basically the same?
Before anyone stacks another tub, remember the regulatory context. Dietary supplements are not held to drug approval standards, and store products can differ from the formulations used in studies. Evidence quality also varies widely by ingredient. So even when a leucine trial looks tidy, your flavored gym powder may not match that dose, purity, or comparator design.
What about older adults with sarcopenia who lift and then take BCAA-rich supplements? If muscle index ticks up, should they expect stronger grip, faster walks, or easier chair stands too? Or is that where the story shrinks?
Hospital critical care is a different baseline entirely. In one randomized trial, recently admitted critically ill patients received a high leucine BCAA regimen providing about 19 grams of leucine inside 40 grams of BCAAs daily for 10 days. Muscle thickness loss was attenuated versus control, and interleukin-6 fell. That is not a gym recovery tip. It is a supervised medical nutrition signal in people with intense catabolism and inflammation. Do not export that ICU protocol into a commercial gym shaker. Liver disease is another specialty lane. Updated Cochrane evidence suggests branched-chain amino acids can reduce hepatic encephalopathy manifestations compared with control interventions, with low-certainty evidence. Effects on mortality remain uncertain, and gastrointestinal side effects, such as nausea or diarrhea, are possible. This is clinician-guided therapy for cirrhosis-related brain dysfunction, not a reason for healthy lifters to self-prescribe megadoses.
Then, who is the actual best fit buyer outside those hospital stories? Is it the person training fasted with almost no protein, the older adult undereating, or is BCAA mostly redundant once meals already cover leucine and the other essentials?
A practical risk for healthy people is displacement. Spending money and stomach space on BCAAs can crowd out the protein foods or complete powders that would have done more. Unnecessary stacking with pre-workouts and random amino blends also makes it harder to know what changed. If total protein stays low, the isolate cannot paper over the deficit, which is exactly what the Leucine trial's negative nitrogen balance warned about. Cognitive claims are still mixed. A systematic review found some studies reporting cognitive improvements after BCAAs and others finding no clear change with dose, duration, and health status matching. Appetite effects in older adults are being tested in a randomized protocol combining BCAAs with tryptophan or methionine, but those results are not published yet, so they should not drive shopping decisions today. Until those data appear, keep cognition and appetite claims in the hypothesis bin.
Where should someone pause and talk to a clinician before using concentrated amino acids, pregnancy, kidney or liver disease, upcoming surgery, or meds that already complicate nutrition? And is food first still the default if none of those apply?
So the clean rule is simple. Use leucine-aware complete protein first. Consider essential amino acids if you need a compact essential package. Reserve isolated BCAAs for specific clinical nutrition contexts or rare situations where complete protein truly is not available. Judge success by training performance, strength, function, or clinically monitored outcomes, not by how dramatic the amino acid blood curve looks after one neon scoop. If the scoop only flatters a lab curve, it has not earned a permanent slot in the stack.